Hi, I'm Pam Simon, the founder and nurse practitioner for the Stanford Adolescent and Young Adult Cancer Program. Rob, a 21-year-old captain of the Stanford football team and planning to graduate with a degree in marketing. Harry, a 15-year-old basketball star and freshman in high school. Letitia, an 18-year-old senior living in East Palo Alto, looking forward to her prom and graduation, and then attending college as a first-year generation student. Christine, a 27-year-old software engineer working at Apple, engaged to be married. Sarah, a 19-year-old single mom of an 11-month-old, working in retail and loves art. What do these all have in common? They are AYAs, adolescent and young adults diagnosed with cancer at Stanford. AYAs are between the ages of 15 and 39. There are over 80,000 of them diagnosed each year in the United States. If they weren't diagnosed with cancer, what would they be doing? Getting their driver's licenses, graduating from high school, college, starting a real job, a profession, establishing their independence, living on their own, starting to form long-term relationships, establishing a family. But for these patients, cancer threw a wrench into their plans, their hopes, their dreams. I created the Stanford Adolescent and Young Adult Program to help support these patients at diagnosis and really throughout their entire cancer journey to address their unique needs, whether they're treated in the adult world or the pediatric world, which neither one really is geared for them. Rob, diagnosed with Ewing sarcoma, and at the age of 21, he wasn't really in a serious relationship. He had no plans to have children, but becoming a father someday was really important to him. He had no idea his upcoming treatment might affect his future fertility. So I met with him, discussed that and other related topics, and after our discussion, he decided he wanted to collect sperm for storage. One patient told me, "We don't know what we don't know. We need to give these patients information so that they can make the decisions that are right for them at the time." Let's go back to Harry. He was diagnosed with lymphoma, isolated from his friends, his peers, unable to attend school and participate in sports. I introduced him to one of our AYA peer mentors who connected with him. They shared similar experiences. Harry realized, I'm not the only 15-year-old with cancer. He'd never met anyone else his age. And as a survivor, now Harry is on our SIAC Advisory Council, and he is a peer mentor for other AYAs. Letitia, she was receiving treatment for a germ cell tumor. She was afraid she wasn't going to be able to graduate and attend college. I met with her and reassured her that she can continue to work on her goals. She doesn't have to put her life completely on hold just because of cancer. We discussed accommodations with her high school so that she could graduate with her class. We also talked about college scholarships that she now was eligible for because of that cancer diagnosis. Christine was diagnosed with acute lymphoblastic leukemia. She was treated at the Stanford Adult Hospital. And unlike the pediatric patients, she wasn't offered anesthesia for her bone marrow aspirate biopsies. She became very anxious when these procedures would come up. So we met to talk about strategy. What could help her feel in control with her next biopsy, which, of course, were going to be many throughout her 3 years of treatment. So we helped her figure out breathing techniques, sort of a plan, a process, help her feel better in control. because being proactive with her anxiety helped prevent that long-term trauma and PTSD that we often see in our AYA patients. Sarah was unable to work during her treatment for AML and required a bone marrow transplant. She was having difficulty paying her bills and supporting her child. I introduced her to one of the many foundations set up for adolescent and young adult cancer patients, DAM Cancer. They provide financial help for AYAs on treatment. This allowed Sarah to really focus on her treatment and not worry so much about her child. She also loved art, as I said, so we provided special art projects to keep her busy throughout her long hospitalizations. This allowed her to tell her story through her art. She's now going to share this in a magazine we're creating, sharing stories of our patients. These are just a few examples of the issues that AYAs face during their diagnosis, treatment, and survivorship. They are resilient, but they need extra support. Our goal as the first AYA program in the Bay Area is to be and continue to be a comprehensive program helping these patients, but also be a model for other AYAs with chronic illnesses. We want cancer to be a bump in the road so that these AYAs can move on with their lives. All patients have a story to tell. Encourage yours to tell theirs. Thank you.